Hello, everybody, and welcome to today's mini webinar on the Lower Healthcare Costs Act. Your audio is muted when you join the call. Questions can be submitted via the question box on your screen. The session will last approximately 15 minutes, including time for a Q&A after the presentation. This webinar will be recorded and available on the PWSA USA YouTube channel. Effective advocacy is essential to ensuring the health, safety, and enhanced quality of life for those affected by Prader-Willi syndrome. As such, PWSA USA is committed to informing the PWS community of critical public policy issues and leveraging the power of grassroots supporters to enact change. Because Prader-Willi syndrome is considered a rare disease, extra effort is needed to raise awareness amongst the public and elected officials to guarantee the passage of legislation and regulations that help our community and defeat those that do not. I'm going to go through the next few slides quickly, but don't feel like you need to take notes. After the webinar, you will be provided with a copy of this presentation, key talking points, and a recording of the webinar. First, we'll cover a little bit about cutting healthcare costs, transparency in healthcare, more about the Lower Healthcare Costs Act, and what you can do to advocate for the passage of this legislation. So let's get started. Let's start with why this piece of legislation is important to the PWS community and the current healthcare situation in the USA. 90% of the nation's $3.5 trillion annual dollars are spent in healthcare expenditures are for people with chronic and mental health conditions, and chronic diseases such as PWS have significant health and economic costs in the United States. According to National Health Expenditures Accounts and the Current Population Survey, in 2016, American households paid on average 19% of their income toward healthcare costs. According to a 2016 study published by the U.S. National Library of Medicine, National Institutes of Health, direct medical resource utilization was considerably greater among participants in the study with PWS versus participants without PWS in the study. Patients with PWS had nearly 9 times greater total annual direct medical costs compared to their counterparts without PWS. Patients with PWS had 176 times greater total medication costs than their counterparts without PWS. By passing this legislation, the amount that families and individuals with PWS pay towards their medical care and prescription costs would be significantly reduced. So let's take a look at some of the key provisions in this bill. This bill is broken up into several titles, so we're going to go through each one by one. Title 1 of the bill is dedicated to the elimination of surprise medical billing, focusing on protecting individuals from out-of-network deductibles and emergencies, and from being billed for out-of-network ancillary services unexpectedly. Title 2 establishes cost-saving measures by reducing prescription drug pricing and providing timely access to generic drugs and directing manufacturers to submit a report justifying any planned price increases. The report outlined in Section 215 of this establishes a fine for noncompliance and requires a manufacturer to list expenditures on R&D, patents, materials, and all other costs associated with developing the drug. A secondary focus of this bill is on improving transparency in healthcare processes in the U.S. Title III aims to improve healthcare transparency through clear expectations for healthcare industry participants. Section 309 requires in-network providers and health plans to provide patients good faith estimates of their out-of-pocket costs for specific healthcare services as soon as practicable and not later than 2 business days after the request. Violations of the requirements of this section can subject a healthcare provider to a civil penalty not more than $10,000 for each violation. Additionally, sections under this bill encourage transparency through additional regulation in some cases, and in others, regulation reduction. For example, Section 301 removes red tape for pharmacists and healthcare providers, allowing those providers to discuss medication options and pricing with patients. Section 305 creates strict requirements that patients must receive a list of services rendered within 5 calendar days after discharge, and a bill must be delivered within 45 days, or the healthcare practitioner or facility must refund the patient in full plus interest. In addition, certain violations of the requirements in this section can subject a healthcare practitioner or facility to a civil monetary penalty of up to $10,000 a day. Title IV of this bill aims to improve the U.S. public health through innovative prevention programs and, in Title V, improving the exchange of health information. Provisions are focused on tobacco, vaccines, and additional training for healthcare providers, and these are indicative of attempts to minimize the number of health issues and, as a result, the amount of healthcare-related costs. Section 414 would follow the lead of 16 states that we currently have that want to increase the federal minimum age to purchase tobacco from 18 to 21. Section 401 instructs the CDC to award grants to outside organizations to conduct national evidence-based campaigns on the importance of vaccines, targeting communities with low vaccination rates. And Section 407 establishes grant programs to facilitate healthcare provider training programs focused on reducing and preventing discrimination in the provision of healthcare services related to prenatal, labor, and postpartum care. Each of the two sides of Congress, the House and the Senate, operate separately as bills are introduced by individuals in each of the two chambers. A person or person introducing the bill is called a sponsor. Representatives introduce House bills designated by the letters HR for House Resolution, and senators introduce Senate bills designated by the letter S before the number of a bill. The House is pursuing similar legislative efforts to the Lower Healthcare Costs Act, which is currently in the Senate. HR 2296, the Fair Drug Pricing Act, for example, is nearly identical to Section 215 of the Lower Healthcare Costs Act, and it requires manufacturer justifications and reports on any drug price increases. In the HR Bill 3630, the No Surprises Act, it mirrors many of the provisions of Title I of the Lower Healthcare Costs Act, offering broad protections to patients by placing new requirements on healthcare providers and insurers. On July 23rd, a policy aide for House Speaker Pelosi indicated a bill requiring the government to directly negotiate prices in Medicare as compared to the current practice of insurers negotiating drug prices will work through the regular order in the House beginning back in September of 2019. Provisions of House legislation could be combined into the Lower Healthcare Costs Act, and should the legislation move to conference between the two chambers, we should see a combination of these bills being passed. Companion bills and related bills are used to maximize the chance of success of a bill being passed. It's important to note that the bill in the Senate has multiple sponsors who are both Democrats and Republicans, so it is truly a bipartisan bill. In addition to the original sponsors, representatives and senators can show their support for the bill or related bills in their chamber by becoming a co-sponsor. By doing so, legislators are demonstrating their support for lowering American healthcare costs to their colleagues. We want more co-sponsors for this bill in the Senate, and we also want people to co-sponsor all of the 22 related bills in the House and Senate, because the more co-sponsors there are, it's a good indication that a bill is going to be passed when it is brought to vote. Now that you know a little bit more about healthcare costs in the USA, its impact on individuals with PWS, let's talk about how you can advocate for the passage of this legislation on behalf of the PWS community. You can send an email or physical mail. Your email or letter will be more effective if you address a single topic or issue rather than a variety of issues that you may feel passionate about. Typed one-page letters are best if you're sending something through the mail. A physical letter is more likely to be read than an email. You can typically find an email or feedback web form in the mailing address of your elected official on their website. Sending an email to an actual person is far better than using a website form. If you have trouble finding the best email or physical address, call the office and ask. I'll be happy to help you find something. Make sure your letter is legible and try to make it stand out by including pictures or bright colors to make sure it gets attention and leaves an impact. Don't do this if you're sending an email, however, as any attachments might get caught in a spam filter and then the staffer won't be able to open it. Keep your letter brief, polite, and free of grammatical errors. You're probably wondering if social media can be used for advocacy, and it can. Social media is a very public way to show your support or opposition to the policies or actions of your representatives. Not every elected official uses social media, but the ones that do are easily found by visiting their official website. When posting, make sure to tag their official page. Include a picture, as this will increase the likelihood that others will read the text that goes along with it. Make it clear that you are a constituent of the elected official, and make it personal. Be aware that any personal information that you post on social media could be available to the public. Making a call is another great and effective way to advocate. It takes less than 5 minutes and is one of the most easy things to do. Staff are dedicated to answering your phone calls, and every call matters. Phone calls require minimal time commitment from you and no traveling. Every elected official will have a public telephone number that constituents can call to leave feedback. This could either be a place where you leave a voicemail or you talk with a staff member. Only call your own elected officials and clearly state the address at which you are registered to vote so they know that you are a constituent. Clearly tell the staffer or the elected official what you want them to do, why it is important, and why you feel motivated to call. Stay polite with the staffer on the phone, but be firm in your interaction as it will be short. You can also attend a town hall meeting. Attending a town hall meeting is a chance to meet with your representative and get updates on what they've been doing. They are usually held in a public setting and are free to attend. Town halls provide a fantastic opportunity to gain face-to-face access to your elected officials. A lot of elected officials right now are holding virtual town hall meetings. If you want to find out when one will be held, monitor your elected officials' website and social media pages, sign up for their email alerts, or call their office for event updates. In a typical town hall meeting, your elected official will speak for about 15 to 30 minutes about activities in Washington. Then they'll open up the floor to questions from constituents. At this point, raise your hand immediately when they ask for questions. The longer you wait, the more competition you will have for the microphone. This is your opportunity to ask about an issue or piece of legislation. In this case, you're going to talk about lowering healthcare costs. Make sure you have what you're going to say prepared in advance. You may only be given less than a minute to pose your question. Prepare a short summary of the bill or issue you are advocating for. Be sure to introduce yourself, state your issue, and then pose your question. You only may be given a minute or so to ask your question, so be prepared. Only ask one question at a time, and if they're not able to answer your question during the meeting, stick around afterwards and find a staff member. They can take your comments, answer other questions, and refer you to other appropriate staff members if needed. I recommend bringing a business card or a printed letter about the issue that you want them to follow up with. And don't forget to network with other attendees while you're there. It's a great way to get other people involved in the PWS community. You can also schedule a meeting to meet with your elected official directly. Visiting your local district office takes some planning, but it makes the most impact. You'll have a chance to sit down with a staff member from your local district office, or maybe even talk to the elected official directly. In order to schedule a meeting, visit the website of the person you want to visit. You should be able to find a contact form for their scheduler or chief of staff, or maybe even a section of their website called Request a Meeting. If there is a web form to request a meeting, fill it out and someone will get back to you. Most state elected officials have district offices that are near your home address. You can ask to meet the elected official or member of their staff in your district office so there's less travel involved. If you want to work with your chapter to advocate as a group, you might want to request a meeting at a local library, town hall, or other local venue to accommodate the size of your group. I really recommend this method, as the more people present at the meeting, the more amplified your message will be. You can expect to spend about 10 to 15 minutes with your elected official, and it's not uncommon for your elected official to have a legislative assistant or staffer hold the meeting instead. While the elected official may only have a limited amount of time during the meeting, their staff are in better position to dedicate more time to you to hear your position and address your questions and concerns. Introduce yourself and make a short statement about your position, your ask, your personal story, and why you came to meet with them. Be clear with what you are asking the person you're meeting with to do. Stick to the issue you asked to discuss. In this case, you want to discuss the Lower Healthcare Costs Act. If the conversation goes off topic, just bring it back to the reason why you came, and don't be afraid to press the staffer or elected official for a definitive answer or position statement in support or opposition of your ask. Ask if the elected official will pose for a photo with your group, and if everybody has given permission to be photographed, share it all over social media. You'll want to thank your elected official and their staff for meeting with you and supporting the PWS community. PWSA USA also has templates that you can use, and we've prepared these boilerplate text, but encourage you to personalize it and personalize your emails, your tweets, your phone calls, and letters. These templates are a guide to help you make your point, but we want you to use your own words and your own personal perspective. Thanks for attending. If you have any questions about the Lower Healthcare Costs Act, please feel free to submit them via the question box on your screen. While you're typing out your questions, I want to remind everyone that PWSA USA is a 501c3 organization, so when you're meeting with your representatives on behalf of PWSA USA, keep in mind you're not lobbying, you're educating, and you're educating your legislators about the issues that are important to you. This is so we don't jeopardize our tax-exempt status. I also want to take a moment to encourage everyone to register to vote, check your voter registration status, and turn up at the polls this November. When we talk to our elected officials, we want to be able to say that 100% of the PWS community votes. If you need help finding out about your voter registration deadlines in your state or voting times, locations, whether or not you're even eligible to register to vote, give me a call and I'll help you through the process. So with that, I'm going to mute and see if we have any questions. It doesn't look like we have any questions today, but if you think of any later, feel free to give us an email, a phone call, or find us on our website, pwsausa.org. You can email me directly at alucy@pwsausa.org, or you can email the info@pwsausa.org email. Our phone number is up on the screen as well, and I hope you all have a wonderful day, and we will see you tomorrow for our final webinar in this series.